So here we have the number from WHO, and it's all around the world. So in the underdeveloped country, we are almost 100% infected with EBV. This virus is excreted in the saliva. This is why it's called the kissing disease. It also can be transmitted via blood. I don't know why I didn't put it here. It has blood transmission also. His primary infection, which means the first contact, the first infection with the virus, is early stage in underdeveloped country and in adolescence in industrialized country. Here, a little bit information about the physiopathology we needed to later on. In the beginning and the primary infection, the virus here takes the first contact with the epithelium. This is where the virus take all the advantage and try to make as much as possible as copies. Here he starts the lytic replication. So this lytic replication will induce automatically an immune response, which can be triggered by the B cell and in association with the NK cell. Here the B cell start to defend our body against the EBV, and the EBV find himself in front of two options. The first one to be eliminated by the immune system, and the other one is to go in what we call the latency. So for sure the EBV, a virus that evolved in a billion years.
Again, BCRA usually keep breast and ovarium in normal condition. If BCRA experience cause the nutrition, it can cause a decrease to cancer.
Okay, so actually there is two questions. The first one is there is a cause of the polymorphism of the EBV, if there is a kind of mutation in EBV that causes cancer, if I understand well. So actually, in science to talk about causality, it causes cancer, it's a very big question. So here we can say in the best scenario that there is a clear association. So is it it's a cause? We don't know, because once we say it causes cancer, which means we can take it as a prognostic marker. So if someone is born, primary infection was an EBV which is deleted, so that's mean it's a marker that he has more risk to develop cancer in the future. So here we are not able to say yet it's cause or not. Maybe one of the hypotheses was that at the primary infection the virus was the wild type. Once the cancer has already started, and because the overproliferation of this cancerous cell, there is a weak point at the gene, which is the 30 base pair deletion, which breaks, and we got the 30 base pair deletion.
And found the mobile parasite. What I mean by mobile parasite is not in the red blood cell, but outside the red blood cell. So it's an extracellular parasite. In 1902, Joseph Everett described that the whole parasite was and named it. So he gave name that was soon as is 1902. By 1904, the recruits provided the evidence that sleeping sickness, which is SS, is transmitted by cystic life, which is the vector of disease. This is the parasite. These are red blood cells. And these are the parasites. These are red blood cells. Parasites. There are two types of the parasite. That is the protozoa, Trypanosoma species, subspecies, that is found in Africa, Trypanosoma. The T. cruzi and T. rhodensis are quite indistinguishable morphologically, so you cannot differentiate them morphologically. This is the cystic fly. It is a female Clostridium species fly that transmits disease. Now, this part of the symptoms is a chakra on the skin of the infected person, which you might notice in the white, but mostly black. You might not see these symptoms as that.
Do you really have prevalence of trypanosomiasis there? If you can really carry out your research to the northern part of Nigeria to go along with to having a better picture of what is happening.
Anyway, it is something like that. But like, if you look at the first two slides, go back. We talk about the old endemic foci and the new foci in the east. So it's because for some time, this is the savannah, this is the trend of Fulani migration. Yes, this is where we used to have trypanosomiasis. But along the way, we look at that. This is Kaduna, that's the headquarters of our institute, and a branch here. But Benue State, being where they settle down more when they migrate to Fulanis, we have a reference hospital there. That is Sleeping Sickness Referral Hospital, Boku in Benue State, under the institute at Nigeria. But as the time goes on, along this way, there was no more of this HAT, maybe as a result of lack of research work.
As to be a small size tumors presenting as bone or soft tissue masses in the trunk or axial skeleton, mainly the adolescents and ingridus. But the overall 5-year survival is 53%, and the prognosis of these tumors are very bad. So renal primitive erector tumor is an extremely rare entity, and it had been documented as isolated case report. So the primitive neuroendocrine tumor is a malignant small cell rounded neoplasm of neural origin, and this tumor often arises in the chest wall and paraspinal region. Common origins include mainly the bones, limbs and genitourinary tract, mainly liver and also pancreas. But when the kidney is affected, the differential diagnosis includes rhabdomyosarcoma, neuroblastoma, Ewing sarcoma, nephroblastoma and desmoplastic small cell round tumors. So coming to the incidence of these tumors, so you can have a look here. So there's a thyroid about 3%, kidney around 3.56%, non-Hodgkin's lymphoma around 4.2%, and bladder around 4.5%, and mainly the colon cancer accounts for 8.7%, and lung
like bromophenol, denied approval like zemigatran, and cessation of development like the phyluridine, primarily categorized as intrinsic, that means it can be predictable or dose-dependent, or idiosyncratic, that means unpredictable, dependent on the drug itself or its metabolite, or both, which actually associated to the genetic variation. So factor predisposing to drug-induced liver injury, either related to the host, like the non-modifiable factors, mean age, gender, and etc., each dependent on which drug taken by this situation or by this stage, like mean the drugs taken from or by children or prescribed to children, different from those prescribed to elderly, but both may cause drug-induced liver injury exposed to them. Okay? Regulated factor like drug-drug interaction and polypharmacy in the elderly especially. Also the physical properties of a drug, the rule of the two, that means the higher the lipophilic the drug with the highest dose is the most the one to be absorbed and the most the one to be exposed, or actually the most one that the liver will be exposed to. Okay? The environmental factor associated with unhealthy nutrition, sedentary lifestyle like usual, alcohol consumption and etc. So classification of a drug-induced liver injury majorly dependent on three values or three.
We did also study in different areas, like in butchers and everywhere. And believe me, we found even in the butchers, all of them, they got ESPs. ESPs, that means they deal with meat being fed with antibiotics, and they deal with it in the prohibited period, because they should keep it before they kill it, and this I found it more dangerous than taking antibiotic, because the antibiotic, if you take the meat and you cook it, it will make it very weak and will be enough to make your bacteria resistant. To not kill the bacteria, but as the picture says, doesn't kill you, make you stronger.
Yeah.
So we have a national policy. They started just last year. Antibiotic, nobody will take it from the pharmacy unless
prescribed.
prescribed. So what I used to do now, because I'm a microbiologist and I know my problem and I need antibiotic, I send my son, I told him, go to the private clinic, just tell him,